Hey everyone, it's me, Fiona Jane, aka Dr. Hikaru. I have not done a video blog, particularly an endometriosis related video blog, in quite a while. But what I discovered when I did my endometriosis video blogs is that they are very cathartic for me, especially if people could take my experience and learn something from it, or at least provide some comfort for anybody else going through it. And unfortunately, this topic is one I wish I would never have to do a video on, but it has to do with being in quarantine and specifically because of a death in the family. So on social media, I'm sure some of you guys might have heard the news now. I know several of my endo sisters have reached out to me about my father passing away really suddenly from COVID. So the first part of this video, I'm going to go ahead and talk about really quick my father and COVID. And the second part of the video, I'm going to talk about me specifically and being immunocompromised. And I say that because I have a feeling that this is the very first real experience of COVID happening to some people. And even though I've made some posts on Facebook, I think this video will help kind of drive to the point. At least for me, it's going to help me deal with it. So some facts about my personal experience with COVID is my father wasn't feeling well. Our family's pretty good at quarantining because my dad is high risk due to his age, and same with my mom. And then I have endometriosis, which doesn't necessarily mean I'm immunocompromised, but with my other medical history facts that we won't go into detail, you can watch my other videos for that. I am immunocompromised. I get sick really easily, and I stay sick longer than most. As you know, I have an invisible illness, so most people don't really see that when you see me. But my family has been particularly aware of that since I moved back in with my parents in January. So my dad wasn't feeling well, but he was doing okay. He was talking. He was telling us how he didn't want us to bother him and ask how he was feeling. He didn't like being kitty gloved at all. And then Tuesday, he goes and he gets his first COVID test. And tells us he's still fine. I am in and out of the house because I am a full-time student as well as I work full-time. So I was spending a lot of time in the studio. And then Thursday, I had friends coming out from out of town who already knew the status of my parents potentially testing, but I was actually just coming out of quarantine for COVID. I tested at the end of October because I was sick. And thank God I was negative. I tested and I wasn't exposed that I was aware of. I just got really sick. And per the protocol these days, if you go in with any symptoms that are cough, cold, flu, tired, fatigue, runny nose, sinus headache, loss of appetite, diarrhea, basically if you're not feeling well and you go into the ER with any COVID symptoms or urgent care, or you try to see your primary doctor, they will have you take a COVID test. My results were negative, so I was happily avoiding everybody. And so when my dad and mom said they tested again, they actually asked me if I could stay with somebody. And I was like, hey, what do you know? My friends are coming in from out of town. I'm going to be out of town starting Thursday. Thursday, my father also went to the VA because he's retired military. And he got another COVID test. They didn't keep him for any additional anything. They didn't even give him any cough meds or anything. They just gave him a test and sent him home. Friday morning, I get a call shortly after 8 o'clock. My mother had called 911. She was distraught, and she was urging me to make appropriate phone calls and call my brothers. So I made it. I was in Reno at the time, like I said. They are an hour away in Fallon. And I went and I met my mom in the emergency room parking lot. So when you have COVID situations, they typically don't even let you into the ER because that is a basically high risk zone for anybody. So they kicked her out, to protect her. She had done CPR on my dad, and for those who don't know, my mom is also she used to be a nurse. So I'm very lucky that between the two parents at home, one being ex-military and one being a nurse, they both knew CPR. And she was able to administer CPR on my dad until the ambulance came. And the paramedics were able to find a pulse and stabilize him, but he could not breathe on his own. So my mom was waiting in the parking lot, and she I met her there, and she told me, not much at this point because she's kind of distraught, but that they were able to get my dad in. They're going to try to intubate him, and they would let her know. So she was just kind of hanging tight, waiting for the next steps. She told me in the whole process, she did not know where my dad's wallet was, that when the paramedics came, she looked in the usual places, so I told her, okay, I'll go back in the house and I'll look for it. I found it, brought it back, and by the time I came back, they told her that he had been intubated. He had been moved to ICU, and that all she could do was kind of wait. So we went back to the house, and this time we talked in the backyard because, as you know, we're very hypervigilant about high-risk patients, such as me, who are immunocompromised, and we talked in the backyard. And at this time, I don't even know the phone call time, but the hospital calls us and they give us an update. And the first thing I could hear, because my mom had put the phone on speaker because she's kind of hard of hearing, and of course, with her in shock, she wanted me to hear it too, was that, they tell her she needs to be ready for the following news. As soon as I hear this, I grab my cell phone and I put my older brother on speaker. And now we get to hear this devastating news that my dad has suffered kidney failure. Both of my dad's lungs are heavily, they're doing some sort of SWAT thing in the hotel across the street, so you might hear that. Both of my dad's lungs were heavily infected. His heart was showing signs of distress, and he had a low pulse. They were feeding him 3 different antibiotic lines to try to keep him awake, the best medicines they had. And they also, he cannot breathe on his own. He had not regained consciousness, so he was rapidly deteriorating. And in cases like this, usually the patient doesn't make it. So that was the latest update. I'm sure you guys all realize at this point they had to ask the family members, the DNR, the do not resuscitate, what our family wanted. And we made the family decision that we just really wanted my dad to be kept alive, and if this hospital could not do it, then please transfer him to one that could. If you are not equipped, and they assured us that that hospital had they were able to treat high cases, high risk, highly infected patients like my dad. It would be best if they didn't try to move him, especially since Washoe County here in Reno, they are overflowing, and some of the patients can't even get the help they need here. So at least the hospital he was at, he could get the help. And in the rare cases that they did need to transfer somebody, and in this case they did not recommend transferring my dad because they had the adequate care, they had more than the adequate care, you would transfer your patient as far as Utah. And so they told us they'll just try to do everything they can right now, but please be prepared for the worst. I hung up the phone. My mother needed time to process. She went back in the house. I started calling all my other family members and started, kind of let everyone know. And then shortly after, the hospital calls me on my phone now, not my mom's because she left me her cell phone. And I said, hi, I just really spoke to the doctor. And they said, our protocol is to allow 2 family members 15 minutes to say goodbye before the patient passes. We think it's that time for your dad. And our understanding is it's you and your mother who are local. He will not make it for your brother coming in from Las Vegas. And I said, I just got off the phone with my other brother. He's coming in from Sparks. It should be a little over an hour. Can he make it? And they said, I really need you to understand that I don't think he's going to make it, sweetie. You need to get your mom and you need to come down here. I'm really sorry to be the bearer of this bad news. So I texted my brothers to let them know I was now leaving the house and taking mom with me to the hospital. And we got to the hospital and they put us in gowns. They had us, do a sanitation protocol, and they told us we cannot stay in the room for more than 15 minutes due to the COVID procedures. So they also warned us that during the time we were in there, it was very highly likely that my dad could either go into cardiac arrest, have a heart attack, or many of the other complications that happen with patients with COVID that are in as dire circumstances and critical circumstances as my dad is in. And they said when that happens, they will need us to evacuate the room. Had it been a non-COVID case, normally they allow you to see the resuscitation situation, but because it is COVID, they needed us to get out of the room stat. So hopefully that won't happen when we were visiting with him, but they needed us to be aware of that protocol. So we went in there. I asked, because I knew I didn't have family members, and my youngest brother is in Japan. I have family members. I asked if I could take pictures or videos so that, we would have something. And I told them, I know it's a very awkward question. I just, without my brothers here, I don't know. And they told me no, but they can't do that because they do not have his consent, but I could FaceTime. And I'm really thankful for that because it allowed me the opportunity to connect my brother and his family in Vegas with my dad and my youngest brother in Japan, who was already on standby because I let him know what was happening. If you don't think COVID is a thing and what I've told you doesn't alarm you, do me a favor and stop watching my video. But it was really devastating to have to, in a situation like that, be holding a camera at my dad. And to just watch my mom and my whole family know that we had to say goodbye, and my other brother was in a bad reception zone, so I couldn't connect him with us because he was desperately trying to make his way to the hospital. And that is that SWAT team I told you across the hotel. I don't know if you want to say we were lucky or unlucky to be in the room when my dad's heart did stop beating, and they called a code blue. My brother arrived to check in at the hospital, to hear code blue being called on my dad's emergency room. And at that point, they escorted me and my mom out like they said they would. They ushered us into the chapel, and they kept my brother outside to let him know that he was going to have an opportunity to see my dad either way, but that typically they don't make it, and we should be ready for that. When they called my brother back in, my dad did not make it, as you are all aware of. My mother actually thought they called him back in because my dad did make it. So I had to tell her he didn't make it again. And at this point, from my dad being okay at 7:30 in the morning, just saying he was tired and he was asleep in bed, and for harassing my mom to leave him alone because he didn't want to be kitty gloved, to 8 o'clock when my mom found him and he wasn't breathing, and she performed CPR to his vitals crashing on him so suddenly, to I'm not sure what the time of death was, but my brother says the code blue was called at 12:30 when he checked in, It's like 4.5 hours. I said goodbye to my dad on Thursday afternoon when I headed into Reno. And so when you think about how quickly COVID can hit and take someone away, that's how quickly it is. He had multiple organ failure. He had probably suffered a heart attack either before the paramedics came, when he was at the hospital. His lungs were severely damaged. My dad was an avid smoker when I was very young. He has not smoked in the last 20 years, I want to say. And they said that his smoking history moved him into a higher risk than his age group, And my dad was diabetic. So that was another factor on top of his age and his smoking history. My dad was a fairly healthy man, without those those two existing conditions. Didn't really get sick that often. We didn't think there was anything. And his body and he deteriorated that quickly. That's my story with my dad's death. That, the second part of it is, as I mentioned, I'm immunocompromised. So the entire time I was at the hospital, I was terrified. They told me and my mom and my brother that once we entered the emergency room, and despite the COVID procedures in place that they put in place for us to say goodbye, that we should assume we are positive. And my younger brother made the decision when he came to the hospital that, with my mom had being exposed to my dad this whole time because we lived together, and that he would go ahead and make the arrangements to be able to stay with her in the house, even though my brother and the rest of my family would be coming to at least be in the area. She's been asymptomatic, so she was tested on Tuesday with my father, and her results came back today negative. We are retesting her because of the recent events, to make sure she's okay. And I left the hospital shortly after some of the affairs were taken care of to get a COVID test in Reno. Fallon this area that I'm in does not do rapid testing, and the hospital would not test me if I did not have any COVID symptoms. And actually, when I checked into the emergency room for my COVID test, they told me if I was not showing any symptoms, they could not administer the COVID test. And I looked at the nurse, the receptionist checking me in. I said, my eyes are super puffy, I'm really tired, I have a sore throat, and now I cough. I'm not sure if that's because my father passed away right before coming here from COVID. And she said, let me get you checked in. So I was tested on Friday. It is Tuesday, and I still do not have my results. They said it should have only taken 2 to 3 days. So I'm just waiting. In the meantime, the decision was made that I could not be near my mom and brother for risk of COVID. I needed to quarantine separately because I'm immunocompromised. And I am so lucky that my friends who originally I came into Reno to spend time with understood that risk, and I'm not alone. I am I'm with somebody. Of the two, one left earlier and the other one is staying a little longer. So one to kind of keep an eye on me as I wait for my results. And COVID has an incubation period that's up to 14 days. So if my test results come back positive, then I can join my family. And that's a really shitty way to look at it. And if my test results are negative, I have to continue to stay away from my family until we are all out of the quarantine period for COVID. I'm fortunate as an immunocompromised person that and with my endometriosis, that despite having the issues I have, I can function fairly normally. And I am fortunate that the way I process things allows me to stay busy and distracted and still help with what I can from a distance with the process of dealing with a death in a family. And it really fucking sucks that I can't physically grieve with my family. It really fucking sucks that nobody can really physically comfort my mother or any of us because of how COVID works. So this next piece is I asked the doctor when they asked us if we had any questions, what should I be alarmed about for my mother so I don't lose her too? If COVID hits this fast, are there any telltale signs? Is there anything we can do to be proactive for her or me or anybody in the event it hits one of us just as rapidly? And unfortunately, I'm sure you know, the doctor didn't have much to tell me. Right now, I'm going to list the common things for COVID, the symptoms that you should get tested, and then I'm going to list a few things the doctor told me that if you are suspicious that it is COVID, to be aware of. So COVID has such broad categorization of symptoms. It could be fatigue, muscle aches, and being tired. A lot of people come in and that may be their only symptoms. Followed by, as you know, the flu symptoms, right? Cough, headache, fever, chills, and sinus. A lot of people say it's here or here. Congestion. All signs of flu, right? You guys are kind of like, okay, that's nice. Biggest telltale signs that you most likely have COVID: loss of taste and smell. Specifically, the paperwork at the hospital said if you cannot smell bananas, that's a good thing. My father did lose his sense of smell on Thursday. So, diarrhea, surprisingly, another one, and constipation. Two things that people complain about. So basically, if you have any sort of sickness, you're probably thinking I may have COVID. It's highly contagious, as I mentioned before. 14 days incubation period is what they tell us. 4 days typically being exposed to someone positive is a number that I've heard thrown around. My mom, like I said, miraculously from her Tuesday test is showing negative, while my dad's Tuesday test, and actually I don't know about his Tuesday test, but his Thursday test from the VA was expedited because he wasn't feeling well. His Thursday test came in Friday after his passing, positive. So those are the symptoms. High risk categories, if you don't already know, are your age group, right? They say that generally health, teenagers, kids and children don't seem to be hit as hard, but my parents' age, so 60s, 50s, 60s, 70s are high risk categories. Diabetes, anybody with heart or lung issues, high risk category. Autoimmune, immunocompromised, like myself, high risk category. And what are things you can do, or what are some signs? The doctor recommended I ordered a pulse oximeter for my mother. That one of the easiest ways to see, or one of the telltale signs to get her to an emergency room, no matter what she's feeling, is if she was 95% or less. Now, I'm sure if you guys have been to the hospital and they put that little thing on your finger and you watch it, most of the time we're around 98, 99, 97. The doctor said 95 was the magic number. So I ordered one of those. It was delivered, and we were monitoring my mom's her oxygen levels that way. So if you know anybody who has high risk, or if you guys know of an essential worker and you're trying to think of ways you can be proactive because it's so suddenly, a pulse oximeter, and 95 is your magic number. The second thing she told us is that if my mom suddenly wanted to be sleeping more than normal, if she already had the other symptoms, keep her upright and do not let her lay down, because allowing a COVID patient to lay down allows the infection in the lungs. And I might have this medical terminology all fucked up. All I know is don't let them lay down, because COVID in the lungs, it makes that process easier for it to spread the infection or weaken the lungs. So we all know that. Watch my mom's oxygen level and make sure she doesn't try to keep her moving as much as possible. And if she becomes a little more sluggish than normal, that is a sign that we need to be proactive in getting her help. So I hope that this video was informative for those who were maybe not have experienced COVID, and maybe it wasn't quite real to them because they didn't have it in their inner circle, to hear it from somebody live and not just see it as some random Facebook post. It makes a difference with you guys. The holidays are around. I hope everybody can enjoy time with their loved ones. Clearly I can't now. And that again would be the SWAT team across the room. I will have to say, I think it's making my video pretty theatrical. But I appreciate anybody who's reached out to me and my family asking how they can help. I appreciate a lot of the love and support we're getting. I understand the need for people to hear details more so now, because COVID has been elusive in a lot of circles. I made this video partly because this is how I deal with shit. Partly because I wanted to inform, and maybe this might save some lives out there. Partly because I wanted you to know, if you're grieving from COVID, you really aren't the only one, despite people saying they don't know anybody. And partly because I'm immunocompromised, and I'm sure there are other people who are immunocompromised who might be going through something I'm going through too. Anyway, same disclaimer, Dr. Hikaru, because this is on my Dr. Hikaru YouTube. Not a doctor, old gamer name, stayed in place. 2 masters, hopefully, by the time I graduate in May with my second master's, but still not a doctor. Maybe we'll work on that next. I don't know. Thanks a lot, guys, if you've made it through this half-hour video. I don't quite have the energy to say something like and subscribe, and don't do that anyway, because I don't do videos as often as I used to. I just decided to come back on the internet and talk about this. There may be a few more videos afterwards, but I'm sure you understand. Me and my family, we're going through a lot right now. All right, stay safe, everybody. Enjoy the holidays.